Hello, this is Kim McAllister. I'm the course facilitator for Community Health Nursing. You may have me or one of our other professors this time for this course. I wanted to take an opportunity to walk you through the course so you can figure out how to find everything. Let's put this on student view and then then you'll see it the way you do. So if you've never logged into the course before, be sure that you click on the Start Here. This gives you information about navigating the course. Get to meet your instructor. Hi. Look at the different technical requirements so you know that if you have the right equipment to view the course. These are some tips on netiquette. You have an opportunity to communicate with each other on the discussion board, and we just want to keep everything nice and polite. You have one discussion topic for the whole course, and that's an introductory discussion where you just introduce yourself to your classmates. And this discussion does not earn any points, but we would like for you to do it so you can all get to know each other. You will have some clinical information. This is new. We had a mandate from CCNE, our accrediting body, that said we have to add clinical. So we do have clinical in this course. You're going to find a clinical coach and work on a community project. And that coach is just going to kind of mentor you and advise you and check in with you and then verify that you do the project. And so because this is clinical, we need to get this information from you. You can take a picture of it or you can scan it, and then we need you to upload it into the course. There's some assignments where you will need to go in and load it all. And we'll go into that in a little bit. We're also using Sentinel City for much of the course, and so you need to register for that and pay for that. If you did prioritization of care in the fall, click here. And if you have not ever logged in, if you didn't take prioritization of care with us, then you need to click here. And clicking on here on this will give you the information on how to register and how to pay. And it gives you information that you really need to pay attention to about how the computer will function with it. And after you've registered and logged in, you'll get this. You need to go to this link, and then Sentinel City will start. And then there's information on how to register, how to pay, and how to get help and so forth. If you're having problems with this, you need to email me because I can get and talk to our representative and we can resolve any issues that you might have. Oops, wrong thing. Let's go back to the course. This is your handbook signature page. You're going to read the handbook and then sign this page and upload it. On your syllabus page, you have your syllabus. The syllabus is also uploaded here so you can see it here. Your schedule. It comes in a nice document that you can keep and has all of your assignments. And although this says you have things due on Wednesday, it's just advisable that you read through everything by Wednesday and then have the rest of the days to work on your assignments. And then you have your clinical coach handbook, which we'll go over in a little bit, and then the RN to BSN handbook. And we'll go back to modules. And you can click here and go to the overview of each module. It will also keep paging through if you want to keep clicking next page, but that takes a while. So you have an overview for each module. You'll have learning outcomes, and then you have a list of activities. On the next page, you have your reading assignments and videos, and then it begins to page through the assignments. You can also go to modules and you can go to each page as you need to. So let's say you've gone through and you finished the first assignment, then you want to come back and do the next one and so forth. You can also go here and look at assignments. And you can go here and go to the discussion boards. And these are the general discussion boards. So each module has a discussion board, and you can go to that and ask questions, and you can help each other out. I also monitor these boards and I will respond as well. Or you can just talk to each other, get to know each other, say, let's meet online and talk about things. And then you can also chat, and there's also the link to Microsoft 365 in the library. Over here is the magic button, and this is the help button. And it's okay for you to use this. The university purchased Tier 1 support. And so you can go here and you can click and you can chat with someone. Let's say you're trying to upload your assignment and it won't go. You can click here and you can chat with someone. You can use also use the hotline. You can call and talk to someone. If you chat with someone, they're going to ask you to cut and paste the URL. This is the URL. And so they're going to ask you to copy that and paste that into the chat so that they can see your page. The only thing they can see is the Canvas page. They can't get into your computer. And then if you call them, they can automatically see it. So either whatever works for you is great. And they are wonderful, and it's usually just one click thing here or whatever, and it's all fixed. If they tell you something that you can't do because something needs to be changed in the way the instructor had a setting in a course, be sure and let me know and I'll fix that. Okay, so this pretty much goes through all of the navigation of the course. So we want to take a quick moment and talk about the clinical. And here you have your clinical information. These are the things that we need for you to take pictures of or scan and upload, and there are assignments for those. We already talked about the handbook signature page. Here's where you will put your life support card, and your card needs to be current throughout the term, so it can't expire before October 12th. And here is where you will upload your immunization record, your TB test results, and your clinical coach documents. Let's take a look at the clinical coach handbook real quick. And this gives you information about the handbook. Let's see. So you're going to pick a location to do your clinical project, and it's going to be based on a vulnerable population that you find in your community, and you're going to do a particular intervention project that makes sense for your vulnerable population. So your clinical coach has to have a registered nurse license. They have to be licensed in the state where you're going to be doing the project. I know not all of you live in Texas, some of you live in other places, and so be sure that they are licensed in that state. And that coach is going to need to send us a copy of their resume or their curriculum vitae, and then we will just check online to make sure their license is still current. And so that's kind of the main thing there. We will communicate with your clinical coach by email or by phone, and they can contact us as well. You want to be sure that you set up a firm schedule with your coach and meet with them. If you're not going to be able to keep that meeting, then you need to cancel that and let them know in advance, because they're giving up their time to help us. And this just talks about the general roles, and this talks about the partnership between us and them. We are going to give them a copy of the syllabus and give them an explanation of the project, so they'll have that information. And we'll give them our contact information so that they can get in touch with us. They're going to complete an evaluation of you, and then we're going to use that, look at that evaluation and determine if you successfully met the requirements. And so this just talks about interviewing with them and preparing with them. What you wear depends on the site. If you're doing something out in the community and your coach says it's okay to wear professional dress, then that's fine. If your coach says you need to wear scrubs, then you need to wear scrubs. Understand you're covered by Schreiner University with our malpractice insurance while you're in clinical sites. And then you have a copy of the clinical coach agreement, which you need to provide to your clinical coach. And then this just is certifying that they met with you and watched with you, and has other information for them to fill out. And you also get the opportunity to evaluate your clinical coach as well. Some of your assignments are course assignments and some are clinical assignments. The ones that are clinical assignments are conveniently labeled clinical assignment. So these assignments have to be completed and you have to complete them successfully. In other words, you have to have a passing grade on your clinical assignments in order to pass the course. Likewise, you have to make a passing grade on your course assignments to pass the course. So you need to pass clinical and you need to pass the course in order to complete the course. If you have any questions about this, please let me know. I hope this introduction helped you understand, and we'll see you soon.